A lot of people online have been asking, is COVID-19 droplet-based or airborne-based? Can you explain to us what this means?
Yeah, certainly. So from the beginning of the pandemic, a lot of researchers, scientists have been looking at this question to answer whether COVID-19 spreads via droplets, which are larger particles that people project when they're coughing or sneezing, or airborne, which is much smaller particles that can stay suspended in the air and then infect someone at a greater distance than 2 meters, or someone who is just basically using the same closed space. The most important thing to point out here is that it's both. It could be both. It's a spectrum. So what's happening is if someone is coughing and sneezing, there are projecting these larger particles, and the distance, the range for these particles is typically about 2 meters. So anyone who is in relatively close contact under 2 meters is at risk of getting exposed to these large particles. Then beyond 2 meters, these particles fall to the ground, fall to surfaces, and they no longer directly infect individuals. But there's also a possibility that through different mechanisms, there might be smaller particles that are projected into the air, and they can stay suspended in the air for a little bit longer. That's still a possible way of infection, and certain outbreaks, certain types of spread situations, studies have demonstrated that the spread could only be explained if we take into consideration the airborne route. Whether it's possible that it spreads both. Whether it is airborne or droplet, you can still beat it. You could still use very simple measures in order to prevent the spread. What we know about the spread here is that the risk of that airborne transmission is increased if we are exposed to certain set of circumstances that are described by the 3 C's. So anytime we're in a closed space, crowded space, or in close contact with someone, that increases the risk of transmission via these smaller particles. And in order to prevent that, the most important measure is to get vaccinated. As you can see from this diagram, these are the individuals that are in a closed confined space. There may or may not be good ventilation there that will take care of of these smaller suspended particles. But anyone who is closer than 2 meters would be at risk of being directly exposed to those particles through coughing or sneezing. But if that person is immunized, they are protected. A person might be a little bit further away, they might no longer be at risk for those larger particles, but they could still be exposed to the smaller particles that in certain closed, crowded spaces could be a factor for transmission. And here, yet again, vaccine is the protective factor that protects this individual, but this individual sadly is not vaccinated, and therefore they're at risk. The third factor is a distance. So if someone keeps a distance, they stay outdoors, avoid these closed spaces, crowded spaces, close contact, they're also protected by the fact that they're distanced. And certainly also the use of mask. When we see someone wearing a mask, that mask is preventing these particles, infectious particles, from being projected outwards. So that person is therefore protecting others in that closed space. So avoiding closed spaces, crowded spaces, close contact, getting vaccinated, most important thing, as well as staying home when sick and getting tested.